Part of your duties may require you to open mail or deal with incoming and outgoing correspondence via email. Please make sure you check with your practice manager what the procedure is for checking mail. For instance, if you get a fax, make sure you use the practice stamp to stamp the fax and then put in the appropriate tray for the GP or practice manager. Have a clear understanding of how the email system works. For example, at our practice, we do not receive clinical information from the patients through the normal email system. There are instructions on the website explaining this to patients, but sometimes patients forget that it is not appropriate for them to put their clinical issues on an email and send it through to reception or the nurses. If you receive a clinical email from a patient, please make sure that you speak to the GP of the patient to obtain further instructions. Most of the time, you will be required to telephone the patient and ask the patient to make an appointment. Ask one of the other receptionists or your practice manager where the stationery supplies are. If you think you are running out of stationery supplies, ask the practice manager what the procedure is for obtaining more stationery supplies. Do not order stationery supplies without getting authority from your supervisor. Make sure you have a clear understanding of the billing procedures for the patients. There are different kinds of consultations, as you would know. Most GP surgeries use an item 23, 36, 44, or even an item 3. Make sure you can tell the patient how much the consultation is going to cost prior to them coming in for their consultation. For instance, when you're on the telephone, make sure you tell the patient that it is a private practice and the consultation fee is going to be X dollars. If the patient is regularly bulk billed, or if it is a bulk billing practice, make sure you tell them to bring their Medicare card. There could be charges for prescriptions ordered over the telephone. There could also be charges for patients who have procedures. Make sure you have a clear understanding of all the costs that are given to the patient. Billing patients for procedures is especially important. For instance, a patient might come in for the day, have to pay a facility fee to actually go into the treatment room, and then pay for their procedure when they get their pathology results back. Make sure the patient has a clear understanding of the way the consultation fees work for each procedure. If you are unsure, ask your practice manager.